Good afternoon, guys. I've got discussion A for you. We're discussing white coat syndrome today for discussion A. Please give me a few minutes to set up for the show, and I'll be right with you, please. Okay. Like I said, we're discussing white coat syndrome today. For A, white coat syndrome refers to a spike in blood pressure or heightened anxiety that occurs significantly in medical settings, often triggered by the sight of healthcare professionals in white coats. The phrase captures a real psychological response that can distort clinical readings and even lead to misdiagnosis if not properly understood. Based on the surrounding page content and supporting videos, here's a deeper look into what it means and why it matters. What is white coat syndrome? It's a form of situational hypertension where a person's blood pressure rises in clinical environments due to stress or anxiety. This reaction is not just psychological, it uh, activates the body's fight or flight response. Response causing measurable changes like elevated heart rates and blood pressure. Why it's clinically significant. White coat syndrome could be more than Dr. Stress explains that people with white coat hypertension may have an 80% higher risk of developing sustained high blood pressure, making it more than just a temporary stress response. High blood pressure at doctor's office highlights how this can lead to inaccurate readings and potential misdiagnosis, especially if clinicians don't account for the anxiety factor. Psychological detriments. Give me 1 second, folks. White coat syndrome, the psychological link, dives into the emotional and cognitive triggers, showing how past medical trauma, fear, or diagnosis, or even sensory causes or sensory cues like antiseptic smells can heighten anxiety. Society scan anxiety coping with white coat syndrome offer strategies for managing this anxiety, such as mindfulness, breathing techniques, and preparing mentally before the appointments. Practical tips for patients. White coat syndrome, how to lower blood pressure at a doctor's office, provides actionable advice like deep breathing, um, distraction techniques, and requesting multiple readings to ensure accuracy. White coat, white coat, white coat hypertension emphasizes the importance of home monitoring to compare readings outside the clinical setting, helping distinguish between true hypertension and white coat effects. Someone like you who's deeply engaged in discriminating health knowledge and designing culturally responsive interventions. This syndrome offers a compelling case study. It intersects clinical diagnostics. There is a rich potential here for myth-busting toolkit development and community education, especially in underserved populations where mistrust or anxiety is around. Medical systems may be Would you like to co-create a resource or framework to help caregivers and patients navigate this? Managing white coat syndrome, that spike in anxiety and blood pressure during medical visits requires a blend of psychological, behavioral, and clinical strategies. Based on the surrounding page content, here is a structured set of approaches that can help patients and caregivers navigate it effectively. Psychological and behavioral strategies, mindfulness and breathing techniques. Practicing deep breathing or guided meditation before and during appointments can calm the nervous system. Okay. Cognitive reframing, reinterpreting the clinical setting as a place of support rather than a uh, rather than a threat helps reduce anticipatory anxiety. Uh, Desensitization, gradual exposure to medical environments, such as a brief visit without procedures, can help reduce fear over time. Distraction methods: listening to music, engaging in conversation, or using sensory tools like stress balls during checkups can redirect focus. Clinical and procedural adjustments: multiple readings, requesting several blood pressure measurements during a visit after a few minutes of rest can yield more accurate results. Home monitoring: using a validated home blood pressure monitor helps distinguish between true hypertension and situational spikes. Ambulatory monitoring: wearing a device that tracks blood pressure over 24 hours provides a fuller picture of cardiovascular health. Pre-visit preparation: arriving early, avoiding caffeine, and discussing concerns with the provider um, beforehand can ease tension. Emotional and cultural sensitivity: addressing medical trauma. Just a minute, guys. Gotta reposition. Okay. Addressing medical trauma: acknowledging past negative experiences and working with trauma informed providers can reduce triggers. Culturally responsive care for marginalized communities building trust through culturally attuned communication and representation can lower anxiety. Give me 1 second to change glasses, guys, because these aren't mine. Just 1 minute. Gotta put a pair on that's comfortable. Okay. All right. Communication and representation can lower anxiety. Patient empowerment: educating patients about their condition and involving them in decision making fosters autonomy and reduces fear. Giving your expertise in participatory design and culturally adaptive frameworks, this could be a rich area for co-creating myth-busting resources for caregiver toolkits. Want to sketch out a community-based intervention or digital outreach model to help normalize and manage white coat syndrome across diverse populations? Absolutely. Cognitive reframing is a powerful psychological strategy that helps people reinterpret stressful and anxiety inducing situations in a more constructive light. In the context of white coat syndrome, it's about shifting how one perceives medical environments from treating or judgmental spaces to supportive and informative ones. What is cognitive reframing? It's a core technique in cognitive behavior therapy that involves identifying automatic negative thoughts. The doctor will find something wrong. Challenging those thoughts by examining evidence and alternative perspectives, replacing them with more balanced interpretations. This visit helps me stay healthy. Reframing white coat syndrome. Practical examples. Here's how reframing can transform the clinical experience. Triggering thought, reframed perspective. I always get bad news at the doctor. This visit is a chance to catch issues early and stay well. They're judging me if my BP is high. They're here to help, not judge. My anxiety is part of the picture. I feel powerless in clinics. I can ask questions, bring support, and take charge of my health. The cuff always hurts and makes me panic. It's just a tool. I can practice with it at home to feel more in control. These shifts aren't just systematic, they help reduce psychological stress responses and reduce psychological stress responses by calming the brain's threat detection system. How to practice it. Journaling. Write down anxious thoughts before a visit, then reframe them with evidence or affirmations. Role play. Practice clinical scenarios with a friend or therapist using reframed language. Visualization. Imagine a calm, supportive clinic experience while repeating reframed thoughts. Self-talks. Self-talk scripts. Prepare phrases like I am safe, this is a routine, or I'm gathering information, not being judged. This aligns beautifully with your myth busting and participatory design work. You could co-create a framing let's see. You could co-create a framing scripts tailored to specific communities, especially those with medical mistrust or trauma histories. Want to sketch out a culturally adaptive framing toolkit or for caregivers or older adults navigating clinical anxiety. Okay, absolutely. Cognitive reframing is giving your thoughts a new lens, one that's greater, kinder, and more constructive. Here are several evidence-based techniques used across therapeutic module mandates with examples tailored to clinical anxiety and medical settings like white coat syndrome. 1. Scenario questioning. Challenge automatic thoughts by asking reflective questions. Example: thought, my elevated blood pressure means something is seriously wrong. Reframe: is one high reading enough to diagnose a condition? What do my readings mean? What do my readings look like at home? Could anxiety be influencing this? Perspective shifting. View the situation from another person's lens. Example: thought, the nurse is judging me for being nervous. Reframe: if I were the nurse, I'd probably understand that many patients feel anxious. They likely want to help, not judge. Normalization. Reminding yourself that your reflection is common and valid. Example: thought, I should feel this anxious. It's just a checkup. Reframe: many people feel anxious in medical settings. My body is reacting to stress, not danger. Failure future focused reframing. Shift from fear to growth oriented thinking. Example, thought, I always panic during appointments. Reframe, I've struggled before, but I'm learning new ways to manage it. Each visit is a chance to practice and improve. Okay, evidence gathering. Compare the thought to real data or past experiences. Example, thought, I'm terrible at managing my health. Reframe, I've taken steps like monitoring my blood pressure at home and preparing questions for my doctor. That shows I'm committed. Okay, reauthorizing or authorizing native therapy. Change the story, tell yourself. Example, old narrative. I'm a bad patient because I get anxious. Okay. New narrative. I'm a proactive patient who's learning to manage anxiety and advocate for my health. These techniques can be woven into toolkits for caregivers, community workshops, or digital outreach models, especially in culturally responsive formats. Want to co-design a framework, a reframing guide that blends these methods with trauma-informed and participatory principles for older adults or marginalized communities. Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a bit for B, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.